and welcome to this edition of Go Vote Omaha, presented to you by the League of Women Voters of Greater Omaha. I'm Aimée Folker, Mental and Behavioral Health Co-Director for the State League, and I'll be your host today for our conversation on the state of mental and behavioral health in Douglas County. The League of Women Voters is a nonpartisan organization, and we do not endorse political candidates or parties. The League does, however, take positions on issues. Our purpose is to empower voters and defend democracy. Go Vote Omaha primarily focuses on policy issues, and as a result, we hope that you will feel better informed when you go to make your decisions at elections. Statistics from the CDC report that between January and June 2019, the average share of adults reporting symptoms of depression and anxiety was about 11%. That number jumped to over 41% by January 2021. The COVID-19 pandemic collectively amplified our need to discuss mental wellness in our communities. At any given time, 1 in 5 Nebraskans report some sort of mental health challenge or symptom. It is our pleasure today to discuss the current state and future of mental wellness and behavioral health in Douglas County with Douglas County Commissioner Marianne Borgeson. Commissioner Borgeson is the commissioner overseeing the area of mental health and on the Douglas County Board. She is the county representative for Region 6 Behavioral Health Care. Region 6 is responsible for the planning, developing, funding, monitoring, and evaluation of behavioral health services in Cass, Dodge, Douglas, Washington, and Sarpy County. Welcome, Commissioner Borgeson.
Thank you. Thank you for having me.
So I first would like to ask, what community mental and behavioral health services does Douglas County currently have?
So Douglas County specifically, we have our Community Mental Health Center, which is located in our health center on 42nd and Woolworth. And what is provided there is inpatient, outpatient, partial day services, and outpatient services. We also provide detox services, which is located down on 16th Street in the old, or it's a Center Point building right now. And we provide those services to the community down there.
Thank you. What type of cooperation is there between the county behavioral and mental health system and the county jail?
So we know that since behavioral health reform and the closing of our regional centers, that there was a gap in services. And what happened is instead of those individuals being able to go to the regional centers, they're ending up in our jails. So we've been very proactive in putting together our community mental health staff along with our correction staff and providing services to the individuals that come within our facility. On top of the services that we provide with a contracted provider of health services for those incarcerated in our jail.
Could you talk more about the crisis intervention team and the CIT program here?
Sure. So the CIT, or the Crisis Intervention Team, was put together, I think back in 2006. And what it was a way to train law enforcement to be able to respond better to behavioral health instances when they were called through the 911 center. And so from that time, it's actually expanded. So we not only train law enforcement, which in the Douglas County Sheriff's Office, I think we currently have about 84 out of our 126 sheriff deputies that are trained in CIT. And I believe the Omaha Police Department is up to about 339 out of their 902 officers. But we also expanded it beyond law enforcement. So we have our correctional guards who are actually the ones who are with the incarcerated people within our jail. We have training for them as well. Our 911 dispatchers, I thought it was important because they truly are the first responders, and so we have them going through the training. We have fire, EMTs. So we've expanded the scope of what it was originally set out for, and it's an ongoing training. It's a long training and it's an intense training, but again, it's all based on being able for those responders to respond much better to mental health crisis.
Could you talk more about the relationship between the county and Region 6?
Sure. So as you said in the beginning, Region 6 is made up of the 5 counties. Each county then has a commissioner or supervisor that makes up our governing board. So we have 5 members of our governing board that oversee the Region 6 behavioral health care. And so what we do in overseeing that is we actually are the planning authority, as you said. So in each county, Region 6 works with that county and its providers in services that we provide for each of those counties. So maybe not everything in Douglas County is provided in Sarpy, or not everything in Sarpy is provided in Washington, but the region works with each one of the counties to see what their need is and to see what their desires are for services, and then we provide those services to those counties.
And speaking of the different counties, we know Sarpy County has decided to go with a specialty mental health court. Yes. But here in Douglas County, we have chosen to do diversion. Yes. Could you speak to that choice and how it's going?
Sure. That actually was started again many years ago in the county attorney's office. And since that time, when one of the county attorneys left and went over to the city side, remember city does misdemeanors and county does felonies, that program was taken over to the city side as well. And what we found was that the county attorney, the public defender, the city prosecutor, and then those that provide the services through the Community Mental Health Center have a great relationship so that they can really coordinate and look at who it is that we want on that program and the services provided to that person to be able to be successful. And what they found was it works. And so they actually want to expand it, and we're excited about that. And so we think that that's a better route to go than trying to start, again, a whole new thing, i.e. the mental health court. But let's expand our diversion because we know it works. We know the people who are really, they're sold. They love the program. And again, it's the best program for those that we're serving.
And I imagine that would also greatly help with the concerns that many constituents have over that prison or school to prison pipeline that we see so often.
Correct. So, and I'll even go one step further in saying that nobody should have to be placed in a criminal justice system in order to get their mental health services. No one should have to go to a jail in order to get their mental health services. No one should have to be on that pipeline as a youth going through a system and only seeing that that's their only option. And so we, again, are really trying to focus on what are those prevention, intervention, and diversion services that are able to keep people, youth and adults, out of the criminal justice system and into the mental health system where they belong to get their services.
Yes, that's wonderful. I'm so glad to hear that it's expanding and that we have elected officials like yourself who care so much about this issue. But for every wonderful program that we have, there's a bottom line, and that comes down to funding.
Correct.
Can you tell us about the funds that are becoming available from the American Recovery Plan Act, or ARPA, as people might be hearing it called? Sure,
I'm very excited, actually. When the funding came down, we looked to see that, yes, there was a section that allowed us to use those dollars for behavioral health. And so we looked at what we could do with those funds in terms of county functions, and then the priority being mental health. And the board was 100% behind that. And what I think happened was, you mentioned in the beginning, you know, there was an 11% before COVID, and then it jumped to 41% after COVID of people with depression and anxiety. And so everybody was kind of talking about it. And those dollars came available, and it was an opportunity that I felt we could not pass up, that we have everybody talking, we have everybody wanting to do something, and so let's really focus and make that a priority. So we have these funds, we have $55 million this year, and then we'll get $55 million next year. And so we're in the planning stages, if you will. People have submitted requests for the use of those ARPA funds related to mental health. And so, but we're putting the plan together right now as we're listening to what everybody's needs and wants and desires are.
Yes, and part of that is that you've been holding listening sessions, which I was so happy to attend one of them. Many of the things that you heard there, you said were extremely moving to you. Can you talk about what you've heard at these sessions and how it's going to impact the decisions going forward?
Absolutely. It was the first time we've ever held such sessions, and they were wonderful. We've had 4 so far, and the first one was focused on the Region 6 network providers. The second one was community providers, not within the network, and then the next 2 were the general public. And that's the one that was, to me, the most moving. And because they were so open and honest and real about their experiences with mental health and told their story, very detailed, but yet very succinct in what they felt was the need, or what they feel the need is for us to look at. So the gaps in the system, the things that we need to change in the system, and the things that they want out of the system. And so to me, that was the most beautiful piece of all of the listening sessions, is listening to what the people who are actually experienced or who have experienced, whether it was a crisis or they're living with it in recovery, but yet have some dips in their recovery, listening to what they really, truly wanted us to hear about and what they need.
Absolutely. I know from my work in peer support that for many, many people, as much as they tell this story, they don't ever really feel heard. Right. And being able to reclaim their narrative and speak to an elected official is truly empowering, and it's a gift to be able to give so many of the people who have felt disenfranchised or secluded or discriminated against because of the mental illness, to see them actively engaged in the political process is always very inspirational.
You're right, and you know, a few of the things that came out of those was the need for the reduction of stigma around mental illness. Even though there's been work in that area, I think we still have a lot to do. And again, we heard it from people who are actually experiencing it. I think further conversation and a further listening session dealing with just that will be one that we do. Another one we did was the one on the CIT and crisis, mobile crisis, because folks were saying that right now the first thing they do is call 911, but they don't know what to ask for. They don't know how to access the system that could potentially divert from law enforcement having to respond to let mental health professionals respond. And they wanted to know how to do that and what it actually meant. What does it mean when you say mobile crisis? What does it mean when you say CIT? So that was a good one as well. So I think the next one will probably be that stigma reduction and what people want to see us do in that arena, because that was heard loud and clear. And the other thing that was heard is the length of time that it takes for someone to get into services. When someone is in a crisis, you may be responding and you may de-escalate that crisis situation, but they can't wait for 3 weeks to 3 months to get in to see someone. And so we need to really try to figure out how to get that ball rolling so they get into those providers in a much more timely manner.
Absolutely, absolutely. You brought up people calling 911, and shortly there'll be a new option, which will be the 988 number, which goes into effect next year, I believe.
Correct.
That new 988 mental health hotline, a lot of experts have called this a real opportunity for our country to reimagine crisis services. And while we have this opportunity, many are also worried that this not done well, this could just tax an already stretched thin and broken crisis response system. So how does Douglas County plan to address this, and how is it going?
Yeah, well, it actually is going very well, and all of the issues that you just talked about are actually being talked about.
Good.
We want the system, that new number, to be able to handle when those calls come in. And so what does that mean? And make sure that we have these services again that are going to be able to help those that are calling. I think the beauty of it is you're going to have folks who are staffing it who are mental health professionals, who have that mental health background, and hopefully, potentially, the peer support specialists that are able to be on the phone and help that person through that crisis that they're in. And so all of those issues that you talked about are being talked about to make sure that we are ready when we take it live, that we have those services available to make that line successful.
And speaking of the new opportunities for peer support specialists and for mental and behavioral health workers, we still have an incredible shortage of those professionals. What is Douglas County to deal? What is Douglas County? I'm getting tongue-tied. What is Douglas County doing?
Say that 3 times fast.
To deal with that shortage, and is progress being made?
You know, sadly, not enough progress, actually. And that is because it's not just a Douglas County, it's actually across the country issue, and the shortage. And so we are needing to really, again, use that Region 6 umbrella to pull people together to see what it is that we need to address it and get more people in the profession. And again, peer specialists, I think, are underutilized, and we need more of them.
They are underutilized. It was wonderful when everybody wanted a peer support specialist, but I feel that being that it is this new profession, new certification and everything within the last 10, 15 years, I'm not sure if organizations have adopted or adapted yet on exactly what they do or how to utilize them. So.
Right, and I think that's where we come in, though, that we are able to help individuals not only get into it, but utilize them and show that they're very successful. We use them in our community mental health center and in our jail.
Finally, this will be my last question, and then we can just chat.
Okay.
But how would you tell your constituents and anyone watching or listening, how is the best way to get involved? If you care about this issue or other issues, how do you get involved in the political landscape? We all know people like to yell at their television, but what's the next step so that they can be heard? And I'm assuming attending listening sessions like you've had.
Yes. That again is a new opportunity that hasn't been there before, and I think the more regular we get with those, the better it will be. And especially now, people have become very comfortable, if you will, with Zoom calls, which is very convenient. They can stay where they're comfortable, but yet talk about a very delicate issue with others. And so I think the more we have of those, that's one way to get involved, but also to get involved just within your county government, because again, we provide them through our community mental health center and at our correction facility and at the youth center. And so any one of those areas where there's a desire or want, or that's where their passion is, get a hold of me. Talk to me. We'll put you somewhere and have those discussions to try to find how you can be a part of making our system better for those that we're serving. That's what I wound out of all of this. This is an opportunity. Yes, it is really kind of small amounts of money, really, when you look at it, but we can make big impacts, and that's what I'm hoping.
Absolutely. And, money always goes further when you can get, the populace involved. You get the blood and sweat and tears of us citizens and residents that love our community and want to make it stronger, healthier, more inclusive.
Yes, yes. And really, I've learned over the course of my work that those closest to the issue actually have the best solutions. And that's where we need to open our ears and listen.
Right, sort of like peer support specialists. They're so effective because they have the lived experience.
Exactly.
And they can come on an equal sort of that understanding.
Yes,
that someone that maybe hasn't had those kind of mental health struggles before.
Yes, absolutely.
And it's refreshing as well. Having the peer support movement is what I find in working with people is that everybody has a story, and we knew that. Everybody had a relative that nobody talked about, or that one strange cousin, or my brother, but we don't really talk about it.
Right.
What I find now is people are talking about it, and it's healing to do so.
Yes, and that's what the feedback we got from the listening session with the public was that they did feel like they had a space, that they felt comfortable, they felt safe, they didn't feel judged, to be able to tell their story and to tell us what really we needed to focus on. And like I say, that's the beauty. That's the beautiful thing of listening to those that have experienced it or are currently experiencing it, to help us with our planning.
Well, I just want to thank you again for being here and sharing with us all the wonderful plans that Douglas County has to help improve our mental and behavioral health service delivery and system. Is there anything else you'd like to share with us today?
Well, I just want to thank you for the opportunity. Again, we can't miss the bigger opportunity to really make an impact on our behavioral health system. And I think all of us working together will be able to do that. And this conversation is really just a piece of it. So thank you.
Oh, sure. Happy to be here. I think, you talked about bringing the different services together. Mm-hmm. And we talked a little bit more, or before the conversation, about where do people go to find out the information, because there is a lot of amazing things going on. Mm-hmm. Is there somewhere within Douglas County where we can see where these listening services are happening, or where other events that might pertain not just to mental or behavioral health, but criminal justice reform, sewage,
yes,
whatever.
all of it.
I mean, the county encompasses so much of just our everyday conveniences.
Sure. On our website, you'll find not only just the information I gave you about what we provide, but we will be putting on all of the listening session information. And again, once we get more regular, those will all be on the website as well. And also on Region 6 Behavioral Health Care. They have a great website for resources and services within that 5-county area, but you can find it on their website as well.
Yes, and they have their brand new wonderful office building too.
Yes, and very good place to collaborate, bring people together.
Very much so. I think that's all that we have to talk about today. I do want to say to any Anybody watching today, if you or a loved one or someone you know is experiencing a mental health crisis, please reach out. Call 1-800-273-TALK or text TALK to 741-741. Thank you for speaking with us again. It has been such a pleasure to join with you here today and with all of you. For the League of Women Voters of Greater Omaha, I'm Aimée Folker, reminding you to inform yourself about the issues, the candidates, and at election time, be ready to go vote Omaha.
Thank you.
Thank you.